So, good afternoon, everybody. It's a great pleasure for us to be here. We are Nini and Georgi, the second-year students of Darmstadt Medical University, and today we're going to represent the topic that I think is really important, and this is the myasthenia gravis and the novelties and treatments of myasthenia gravis. So, first we're going to now review, briefly, what is myasthenia gravis in general, and then we're going to talk about more important and more interesting stuff like therapies and the treatments that we have for myasthenia gravis. So, as we know, myasthenia gravis is an autoimmune disease in which the antibodies are directed against the postsynaptic cell membrane receptors of the neuromuscular junctions, which causes muscle weakness and fatigability. So, myasthenia gravis affects both children and adults. And the types of the myasthenia gravis that can be presented in children are three major types. We have the congenital myasthenia gravis, which is really a rare form of myasthenia gravis, and this is transmitted as autosomal recessive disease. And it is important that the symptoms are usually in the first year of baby, and they are mostly life-threatening. And then we have the second type of the myasthenia gravis in children. This is transient type of myasthenia gravis. This is a temporary type of myasthenia gravis because it lasts about a few weeks, and it occurs when the antibodies common in the myasthenia gravis cross the placenta to the developing fetus. And last we have juvenile myasthenia gravis, which usually occurs in the Caucasian females, mostly in adolescence. So, unfortunately, myasthenia gravis has really high prevalence. Up to 10 to 20 people in 100,000 can be affected by myasthenia gravis, which is really high indicator. And it's important to know that when we're talking about the adulthood and the puberty, both females and males are affected. Females are more likely to be affected, but when we're talking about the childhood, both males and females are equally affected. So the highest presentation of the pediatric myasthenia gravis is in Oriental people, and it's less common in the Caucasian people. Up to 50% of all cases of myasthenia gravis in Chinese population is in children. And this myasthenia gravis, which is presented in children, are associated with the ocular features, which is usually then followed with more generalized weaknesses like proximal muscle weakness, dysphonia, dysphenia, and so on. Now we have the most important part of our presentation. This is the therapies for myasthenia gravis, which is divided into two major subtypes. The first one, we have the short-term therapy, which includes symptomatic treatment, and then we have the long-term therapy, which includes intravenous immunoglobulins, thymectomy, and hematopoietic stem cell transplantation. So, first one is short-term therapy, which is most frequently used, and it's all about using drugs like etofonium and ribostigmine, and they inhibit the action of acetylcholinesterase, which means that the concentration of the acetylcholine is increased, so the autoantibodies from the receptors can be detached. That means that muscle weakness, like muscle movement, is not limited that bad. And despite of the fact that we know this could be beneficial and we can get the effect, like in this case, muscle movement is not limited that bad, it is important, and especially when we're talking about children, that there could be some kind of side effects like bradycardia, nausea, and excessive salivation, and this is due to the cholinergic action of these drugs. And now, Georgi is going to continue our presentation.
Now we're going to talk about long-term therapies. The first one is intravenous immunoglobulin, and unfortunately we couldn't find any randomized trial about intravenous immunoglobulins on children, but the results of the research was sufficient enough to be discussed today. So there was a randomized double-blinded trial conducted on 51 patients aged 18 or older, and they were divided into two groups with relatively the same characteristics, and the disease severity was determined by a QMG score. The QMG score is quantitative myasthenia gravis score, and it is determined by addition of individual patients' distinctive symptom scores. And the patients in one group received placebo, which is 5 dextrose in water, and the other group was receiving the intravenous immunoglobulins. And they were then checked 14 and 28 days later. And on the 14th day, there was a significant improvement in patients treated with intravenous immunoglobulins and compared to patients treated with placebo. And we can see on the diagram with the red line that patients treated with intravenous immunoglobulin had improvements of 2.5 units in the accuracy score compared to 4.89 units improvement in placebo. And also we should note that in patients who were there was no worsening in patients treated with IVIG, but compared to 4% worsening in patients treated with placebo. And the most important in this treatment is that intravenous immunoglobulin was especially beneficial in patients treated with in patients who had more severe disease than patients with milder myasthenia gravis. The second important long-term therapy is thymectomy. Thymectomy has several surgical approaches. This is full or partial sternotomy, also thoracoscopic and transcervical approaches. And thymectomy is usually done in acetylcholine receptor seropositive patients and isn't recommended in muscle-specific kinase positive patients. And during thymectomy, germinal centers are removed, so no more antibodies are diversified to attach to the receptors, and the autoantibodies are no longer diversified to attach to receptors, and muscle weakness is no longer limited. And also, this thymectomy isn't recommended in prepubertal children due to increased risk of anti-muscarinic side effects in cholinesterase inhibitors after the surgery, and the immunosuppression after surgery can increase the risk in prepubertal children of infections, and also it decreases their tolerance to vaccines, and also there is a high probability of developing Cushing syndrome, which is because most drugs are steroids. And now we're going to talk about hematopoietic stem cell transplantation, which turned out to be the most beneficial treatment in myasthenia gravis. This is the case of 17-year-old boy who had HLA-matched sibling, and before transplantation, he was receiving intravenous immunoglobulins, also pyridostigmine, and also he was receiving frequent plasmapheresis, and his main symptoms were ophthalmoplegia, also oropharyngeal and big muscle weakness, and overall limited mobility. And after transplantation of colon stimulated factor mobilized CD34 peripheral blood cells, his symptoms were significantly improved. For example, he didn't need any transfusion after the 9th day, and also after 7 months from the transplantation, he managed to reconstitute the TNB cell immunity, and after 40 months from transplantation, he was completely free of any treatments, and he gained normal muscle strength, and he became an athlete. And unfortunately, his oropharyngeal, his ophthalmoplegia remained, and his autoantibodies were slightly elevated, but not sufficiently enough to manifest the symptoms of myasthenia gravis. And we wish that more randomized trials were conducted on children, and more people from all over the world were involved in that. And also, we hope that appropriate attention will be paid to the hematopoietic stem cell transplantation, which turned out to be the most beneficial outcome in treatment of myasthenia gravis. Thank you.